Hey folks, it's Patriot Nurse. Thank you for joining me today. In this segment, I want to discuss with you the serious and cautionary lessons that we have learned as a result of protocols that hospitals are enforcing, all in the name of COVID, and what this means for the violation of patients' rights, which we have seen and are demonstrably provable, but also the position that it puts nurses and healthcare providers in. And I want to try and unpack this and really communicate to you the danger of what we are seeing, why this bothers me in particular as a nurse, and why this bothers me from a point not just of a care provider, but also as one who took an oath, the Florence Nightingale oath, and took it seriously. So in my life, I've practiced in various areas of nursing. I practiced in inpatient psychiatric, med surge, childbirth, labor and delivery, home health, emergency and trauma. So I have a fairly wide experience and swath of input as far as dealing with patients and patients' families in various different settings, all of them stressful in one way or another, many of them life-threatening. And when I consider the protocols that have been implemented under the guise of COVID and the greater good, so much of it is truly revolting to me. And I think that there's a preparedness lesson here that we need to derive from it. Many of you have unfortunately had family members in the hospital for various different reasons. I myself have had family members in the hospital, not for COVID, but since the entire thing came into swing over the past year, I've had family members hospitalized. And what is disturbing, hospital to hospital, of course, and state to state even, the protocols are varying as to who is permitted to be with the patient and who is deemed acceptable from whatever calculus it is that they grade their community risk threat with. But recently I was made aware, aside from the fact that people have been, frankly, gasping their last and final and dying breaths with the sole comfort of care providers in full PPE with no physical touch and the cold screen of an iPad connecting them with sobbing people over a crappy internet connection and horrible audio and visual quality. This is appalling from a care standpoint. This is appalling from a human dignity standpoint. And we're coming to a place, and I know that I'm going to get hate from people, but this isn't about Patriot Nurse at this point. This is about advocating for patients. This is about advocating for human dignity. And this is certainly about learning these lessons now so that we can avoid having to pay painful consequences in the future with our own family. Limiting patients from having family members. There's a sweet spot, okay, as a nurse. When you've got 10 family members in a room, it's not therapeutic for the patient, overwhelmingly. Overwhelmingly, it's not therapeutic for the patient. But there's a sweet spot of at least having a couple people, or for instance, like the husband and wife, or the immediate family, particularly in cases where people are in their last moments. Obviously, like this is something that is so troubling to me that's being denied from so many people. That it's really sick and I think very twisted and quite evil when it comes right down to it. And the people enforcing it, the nurses, healthcare providers, the floor level care providers, they don't like it for the most part. They know that it's not right. We know that we're supposed to be an advocate for our patient, but particularly in times, and the whole claim is that the census is too high. The census is too high and that our nurses are overtaxed and they can't be, running about with family members. Look, like I get it, truly. Like we all know who have put any time in on the floor that for the most part, family are okay and supportive. And every now and then you get some that just are terrible to deal with for the patient and also for the staff. But what's very troubling to me is that in a time where your patient to nursing ratios are atrocious, when your nurses are overtaxed, when the demands upon the nurses are at their highest, that our patients are now being limited in their advocacy. So the thing is, like with nurses and with healthcare providers, but particularly with nurses, we are charged with being advocates for our patients. And if a nurse is so stretched thin that she or he can't advocate for the patient, there needs to be, for a patient's safety standpoint, another advocate within physical proximity to that patient. People say, oh, that's not just necessary. Oh, it's cluttered. Listen, I can tell you stories of being in countries in Southeast Asia, going into hospitals and finding out, much to my disgust, that nurses were withholding care from infants in order to receive bribes from family members. There's a power structure that exists whenever families are denied access to their loved ones. And really, when it comes right down to it, it's a form of imprisonment. And many people have elected. I saw an article, I think it was in the Epic Times a couple of days ago, that noted that many people took their family members preemptively out of nursing homes in fear that they would contract the disease and the virus, be hospitalized, and then be alone and die in isolation, completely bereft of companionship and closeness of their kin at a critical junction in life, where it is a right, a human right, to have your loved ones close by you when you die. And I will stand by that 100%. Patients have rights, and family members have rights to be with their loved ones at life juncture points, both birth and death. And to deny family members the access to hold the hand of their loved one as they're dying is atrocious. People say, oh, we do this routinely all the time. Yeah, when we're coding people. Yeah, like when we're doing hardcore interventions. But they're even moving it now, at least in the last institution that I worked with. They're moving it so that if you got to code a patient, code them with the family in the room, unless the family are just coming all to pieces. Our patients deserve advocacy. If we cannot give it to them because our ratios are so terrible, the family members should be there. And I don't care what the hospital staff says or the protocol says. So going forward, there's another point here that I think is worth addressing, and that is the restriction of family members to one, at least this was the case in one of my family members' instances who was recently admitted to the hospital, that my family member was admitted, and my other family member who accompanied them to the hospital was essentially ascribed sole permission to enter and exit the hospital and sole permission to give care to my family member. And this makes no sense. You cannot make a justification for this, certainly not from a community health standpoint. Oh, we're limiting transmission. Bull. They're coming right back home to the rest of the household members, right? Like, this is nonsense. Limiting one person, and we all know this as nurses, and certainly for people who've been in support, limiting one person as the sole and designated helper for the family member only creates caregiver fatigue. And frankly, if for those of you who've ever spent a night in the hospital, you know how uncomfortable it is. You know you're not sleeping well. And if the care providers or the family members, designated family members, are not sleeping well, that's putting their own immune system in challenge. Far better to have them go home and sleep in their own bed and take shifts if need be. But this is all coming back to this classic argument of the greater good. And it's something that has always troubled me as a nurse, because when I first came into nursing, and this is like Patriot Nurse tells all, when I first came in to nursing in the early 2000s, it was a completely different world. Granted, we were still being infiltrated, particularly at the collegiate level, being infiltrated with Marxist elements. I had some wonderful nursing instructors in college, and I had some absolutely terrible ones who I would not trust with a dying toad. And when I consider the mindset shift and the push for adaptation of socialistic mindsets of the greater good, it's all for the greater good, and the rights of the individual don't trump groups of people don't have rights. Individuals have rights. And if you want to safeguard the rights of a group, you safeguard it on the micro level, on the individual level. We don't do people a favor, but en masse, by violating the rights of individuals. So when I look at what is happening, this precedent has been set for a long time. This precedent of depersonalizing people, this precedent of taking patients and stamping them with numbers and creating a chattel-like mindset. This has been coming for some time. Not all healthcare providers view patients this way. God forbid. God forbid. There are many who I have worked with personally who did not. But I have noticed in my own career, and have noticed for over a decade now, a decade and a half almost, particularly since the Obama administration, a very steady rise in the infiltration of various healthcare advocacy organizations by dedicated Marxist elements. And the way that this practically plays out with the whole COVID thing is that we are seeing this indoctrination take place that Once you are surrendered into their care, you're their prisoner, effectively. And that's very, very dangerous. I, for the most part, viewed patients' families, unless hardcore otherwise proved in contradistinction, I viewed them as assets because, for the most part, if you have family members, and maybe I was just blessed with great family members, if you have family members who are proactive and who want to do things, they can help you. Like, they can help you and your nursing staff, like little things like water, and they can do that. And by denying admitted patients access to fresh care providers, we're starving our patients not only of care, but we're also making our jobs harder as nurses. And I think this is varying, obviously, policy-wise from hospital to hospital and state to state, but it's something that's very troubling to me. In particular, it's troubling to me because we see that there is an increase in weaponization of everything that the federal government has its tentacles in right now against conservatives and against people who value traditional and constitutional ways of living. To have to wrestle in your mind with whether or not you're going to admit your loved one because, A, if they're admitted and they get sick and they go south, they're going to die alone with nothing but a screen to connect you to. That is a terrible position to be in. And many people have elected, you know what? I'm not doing that to my family members. I will take them out of the nursing home and I will care for them at home because I'm working from home remotely anyway. A, it'll save money, and B, I can be assured of the quality of the care that they're going to get. Families and patients should not be put in a circumstance where some abstract greater good is prized over their ability to ensure quality care for their family members and advocate for their family members. We are being trained right now to surrender people into a medical grid, like a one-way train. And that's very, very bothersome to me. All the more reason, I submit to you, friends, to resurrect the skills of old and to resurrect home care technique, home care assessment skills. This is more critical now than it ever has been. Not just for preparedness in the future, but recognizing that we are dealing with a healthcare grid that, like it or not, is actively being used as a tool for indoctrination, weaponization, collation of data, and ultimately for the denial, I think, of services, further weaponization against people who don't toe the party line. The last thing that you want to do is to surrender your family members alone without the ability to connect with them. And I'm telling you this, like, if I had $1 for every time patients would ask me, they'd ask me for my opinion. And you got to do the right thing. Do you want my personal opinion or you want my professional opinion? They never ask me for my professional opinion. You know why? Because people want to know that you're going to sit in their shoes and you're going to hold space for them and be a person with them, not be a bot churning out knowledge. If they wanted that, they'd go do a Wikipedia search. So, friends, it's very troubling seeing this and seeing the way that it's manifested. I have tarried in speaking about it for a while, really because I was hopeful that the situation would resolve, that it was just a critical stress point in the overall medical infrastructure. But across pretty much every industry right now, it seems to me that we're seeing this expectation of a vertical interaction, like parent-child dynamic, of a vertical interaction where there prior to this was a horizontal interaction. And that's very, very dangerous. And it should be resisted. And it should be hopefully selected out of or avoided if you can. And so I hope, friends, that in the days to come, that you will be wise about the interactions, particularly elective interactions that you have with a healthcare system that is being used right now to deny people their rights. And that is beyond dispute and beyond questioning. Am I, as a nurse, advocating that people not seek help or not seek care when they need it? God forbid. God forbid. But we are being faced right now with dilemmas and choices that we have never seen in this country before. Certainly in the past 2 generations, 3 generations, really lifetime. I have to think about it now. I'm in the middle generation now. We've not been faced with things like this. But we must consider our preparedness in factoring these things as well. I hope it was helpful for y'all today. If you enjoyed the video, I hope you'll subscribe to me here on YouTube. You can also support me on Patreon, Subscribestar, Cryptocurrency, and PayPal. I have links down below. If you want to get training in medical preparedness, take my course online. I got a link down below, ThePatriotNurseAcademy.com. It's 4 hours. It's $129. If you don't have money, I've got 10 years worth of back catalog here on YouTube for free that you can watch. You can also come and train with me in person. You can find that at ThePatriotNurse.com. I hope it was helpful for y'all. Have a wonderful weekend. For now, it's Patriot Nurse signing off, and I'll see y'all later. Bye.